Something we've been trying to do at Dell, and that's create an atmosphere for children and adolescents and families that is less threatening and more comforting for their care. The project originated this past spring when we started surveying nationally children's medical centers across the country to see what approaches were being used. And what we found was interesting, and that was that there were a few things being done at different centers everywhere, but nobody had taken the complete package of comfort zone and comfort materials and interventions and put it into a single system that was available at any one site.
We have some books on the bed right here. This is one of the materials that we use a good amount, which is I Spy, and this provides a good distraction for multiple procedures, IVs, stitches, INDs, which is incision and drainage of abscesses. And what this can do is not only distract the child, but can also block the procedure that might be traumatic to see. We also have a magic wand that has some glitter and stars in it that can be very soothing for a child, and a light-up globe that spins around and makes lights. And this can all be very distracting. We also have a CD player, and with the use of the nitrous oxide can be beneficial to have music playing. So we have all of these things available on the unit, available to staff, and Child Life is also available to help with these procedures too. So.
Maddie the blowfish is a device that we use to give small children pain medicine and sedation without an IV. Because it's a fish and colorful, they're sort of focusing on that and not the syringe. You can kind of hide it in your hand. And this just goes right at the outside of their nose, and you see the medicine sprays out in a mist up their nose, and in about 10 minutes, usually their pain is gone. We're looking at patient satisfaction with prior methods of pain control, and then what happens with the new methods of pain control and comfort measures. We hope that this is going to change the practice not only here, but we're already seeing some of the other hospitals expressing interest in this sort of approach, and we hope that once we get this published, it helps set the standard nationally for a way to bring all of these things together for children everywhere.